KSL News at 6.
Good evening. Open enrollment just weeks away for the Affordable Care Act, better known as Obamacare. Get ready for some sticker shock. New numbers show big jumps for health insurance rates throughout the federal marketplace.
Political specialist Ladd Egan's live at the Capitol tonight, where lawmakers today learned about the hikes. And Ladd, how many Utahns could this affect?
More than 170,000 Utahns get their insurance through the federal marketplace, and already letters are hitting mailboxes explaining which plans will see the largest increases next year.
It's obvious that it's failing. It's dead. It's essentially dead.
Months of uncertainty in Washington and numerous failed attempts to replace the Affordable Care Act have resulted in skyrocketing insurance rates.
Insurance premiums go up every year, but this year we're seeing a spike that is unrelated to medical costs, prescription drugs.
Jason Stevenson with the Utah Health Policy Project presented the numbers to this legislative task force, showing that overall rates through the federal marketplace will jump 39% in 2018. In Salt Lake County, the silver plans will increase the most, almost 62%, while bronze and gold plans also jump in the double digits.
It is disconcerting.
Democratic lawmaker Rebecca Chavez-Houck worries about Utah's families affording the increases and says the Republican-controlled Congress is succeeding at undermining Obamacare.
And we heard from a family where their rate is going from about $790 to about $1,300 because they don't get subsidies.
The good news for lower-income families is that subsidies will cover most of the rate hikes, while others will be left to foot the bill.
They're not changing the policy, but they're doing it through appropriation. They're basically starving the program so that it doesn't succeed.
For those seeing a huge jump without subsidies to help, the best advice is to shop around.
You can't just go from the plan you had last year to the plan you have this year, especially if you see a significant increase, because there's better deals out there if you look.
Other changes will also affect next year. Utah will only have 2 insurance companies to choose from in the marketplace. That's compared to as many as 6 companies just a few years ago. And folks will want to check their calendars, Deanie. That's because the time frame to enroll has been cut in half compared to previous years.
A lot of concerns then on this forefront for so many Utahns. Ladd, thanks.